Hello, everyone. Thanks for joining us today for another educational video on Medicare. My name is Keith Knabb, and I'm the founder of Affordable Medicare Solutions. We are Georgia's largest and most award-winning Medicare planning agency. It's not just me, there's 10 of us here, 10 employees that are working year-round to help people to manage their Medicare. So let's get to the topic today. We're going to talk about something unusual that happens every now and then, called a 5-star rated plan. That means a special, excellent rated plan and what that can do for you to help you manage your Medicare. So let's get to the topic at hand. 5-star Medicare plans. This is what Medicare does each year, and they release these ratings in October or maybe November each year. And what a star rating means, it means quality. It is what level of quality has a plan been ranked. So it goes from 1 to 5 stars. And this applies to prescription drug programs and Medicare Advantage HMO or PPO Medicare plans, the Advantage system. This does not apply to Medicare supplements. So if a plan receives a 1 or 2-star rating, that is unusual these days. It happened a few years back a lot more often, but plans have gotten much better at managing their quality ratings, or low-rated plans have been acquired by larger companies or have gone out of business. So 1 to 2 stars means poor or below average. If a plan gets ranked at a 1 or 2-star rating for 3 years straight, which I don't think has happened in the last 5 years in Georgia, a client on one of those plans can switch their plan and get off of it outside of the annual enrollment period. That is a very rare or unusual circumstance. It just doesn't happen very often. But if a plan has 3, 3.5, 4, or 4.5 stars, that is above average or average. And they do get bonuses. Medicare pays those plans bonuses for hitting those achievement marks. And those plans are just normal plans you can change during the annual enrollment period, October and November up till December 7th each year. So that's when you would manage your plan if you're on a 3- and 4-star rated plan. But the topic today is about 5-star plans. This is a rare occurrence. It's happened about 5 times over the last 16 years here in Georgia, where we've had a plan ranked, 1 or 2 different plans ranked at 5 stars. And this means it's an excellent rated plan. And that means that it gets full privileges and it allows people to enroll into the plan all 12 months of the year, not just during the annual enrollment period. So this is really handy. Somebody comes to us and says, hey, I've got a Medicare problem. And if we've got a 5-star plan in their area, we can manage their plan outside of the normal restrictive time periods. The overall star rating gives an overall rating of the plan's quality and performance that fall into 5 categories: screening tests and vaccines, managing health conditions, the actual member personal experience, member complaints, and health plan customer service. Qualifying for a special election choice based on star ratings is a rare circumstance, but it has happened here in Georgia, and it is something that can be exciting and help people out with managing their Medicare. But this is how Medicare rates the plans. Medicare actually looks at member surveys, information on the plans that health care providers submit. They do regular plan monitoring during the year of monitoring the plan's behavior and successes and failures. Billing and other information about drug coverage that is submitted to Medicare. That's a very hot topic on the how the plans manage their prescription drug benefits. And this is the information about enrollment periods. So remember, there are all different types of enrollment periods for Medicare. And when we're talking about somebody turning 65, that's their initial election before they turn 65. If we skip over here to annual election, that's what I was describing as the October 15th to December 7th annual Medicare review period, the annual election period. In January, February, March, there's also another period called the Advantage election open enrollment period for managing those plans. But a 5-star issue is a special election. That's one that says special election That is where the 5-star plans fall in. So when somebody says, I want to change my plan in August and move to a 5-star plan, that's a special election period because of the unusual circumstance of a 5-star rated plan. So it's really a matter of knowing that the average consumer will get confused by these enrollment periods. That is why people use affordable Medicare solutions, is to help them understand which one of these periods is the best to apply to their circumstance and gives them the most advantage on managing their Medicare successfully. We know how to do this creatively. Also, people who have special needs, such as chronic illnesses for diabetes or heart problems or kidney problems, or people that are low income, we've got even more flexibility to manage their Medicare. So we will look at the entire picture and decide what enrollment period applies best. And if it's a 5-star enrollment period, we're going to use that to help you out to manage your Medicare. The 5-star enrollment period. If a Medicare Advantage plan or drug plan with a 5-star rating is available in your area, you can use a special enrollment period to switch to the 5-star plan. You can use this SEP only once between December 8th and November 30th. And that's fine. That would be a perfect time to use that one-time mulligan. Now, things to look out for when switching to 5-star plans. If you move from a Medicare Advantage, HMO, or PPO plan that includes a drug plan to just a standalone drug plan, a 5-star drug plan, you will be disenrolled. They will disenroll you from your old HMO or PPO, and you will be assigned to original Medicare with that new drug plan. If you move from a Medicare Advantage plan, like an HMO or PPO that includes a drug plan, to a 5-star Medicare Advantage plan that does not include drug coverage, you will lose your prescription drug coverage. And this will also potentially create a late enrollment penalty for the next time you do pick up a drug plan. So be careful. Don't do this on your own. Use a professional Medicare service to make sure you don't screw that up. So thank you very much for joining us today. We offer free Medicare planning services. There are no charges to the thousands of clients that use affordable Medicare solutions. We are in Suwanee, Georgia, and we serve the entire state of Georgia. We also do work outside of the state and help people throughout the United States. Now, our phone number is 770-945-5261. There are people here 12 months a year, 10 employees to help you for free, or your friends and family. Have them call us. Sometimes we just give out advice and tell people, what is available, and maybe in a year or two, they become our client, but that's fine. All of our services are free for Medicare. Thank you very much. I hope you have a great day today.